Hello everyone, Christian Jacobs here, Brother Be Well Clinical Advisor. Today I'll be talking to you about a really interesting topic, which is mental health and families and the importance of discussing mental health and families. And today I'll go over a few topics on this. This is part one of our mental health and families discussion, and you can catch part two on a separate video. But this segment here will be broken down to three parts, three important factors. And number one is really looking at how important it is to talk about mental health in your family. And number one is really learning the early signs of mental health and really understanding how to identify those mental health symptoms in your family early in the stages of development, in terms of anything that you may have to intervene or talk to your family members about. Second one is also looking into developing healthy relationship patterns. So I'll talk a little bit about developing healthy relationship patterns. And also the last one is really looking at developing a long-lasting, positive, multi-generational stress traditions, and how to identify those stressful traditional patterns that families teach that are passed down through generation to generation. So those are three topics that I'll discuss briefly today. So just going back to that first one, we're looking at the signs of mental health issues, is really identifying, really, first of all, knowing and understanding your family. That's the most important thing, is really understanding some of the basic behaviors that your siblings or your brother, your sister, your mother, and your father may behave under, and then really determine what are some of the behaviors that you notice that have changed over time that are significant. So I'll give you an example. You may notice that your brother or your sister or your mother wakes up every morning to work out. They wake up every morning to go for a run, or they wake up every morning to either, go for a walk, or they cook breakfast traditionally. And you might notice that there's a change in their daily pattern where they have decided to do behaviors that are opposite of what they normally do. So now, instead of working out every day or cooking and cleaning the house on a routine, you notice they're staying in the bed all the time, and they don't do the things that they normally do on a routine basis. This is one thing that you, again, it's not really a indicator or a definitive thing that says this person has a mental health condition. These are just the signs that you're looking for in terms of mental health conditions. Second is really looking at a change in their normal patterns of business. So if you notice that they are consistently going to work on time, and they usually wake up and get dressed and leave the home, and you notice that they've been calling in sick a lot, or they don't want to go to work anymore, this is a sign that maybe some type of symptom may be setting in terms of stress and worry. I'm going to go to the next point, really looking at the second theme, which is really developing healthy relationship patterns. The importance of developing these relationship patterns is really contingent upon, it goes two ways really. So really understanding how to work with your other, either your partner, it could be your wife or your husband or your siblings, really developing that positive relationship pattern. And that's really developing a communication style. So you really want to understand and have an understanding, a mutual understanding with your family and also with the other person, what your communication style is. So if you know that person is better off communicating in writing, or they better communicate in person, direct contact, or you know that maybe they get upset. When they get upset, they like to yell. These are some of the things you want to understand about your family so you can develop those communication patterns. And once you understand those communication patterns, you want to talk with that individual to set up a mutual understanding of how you will communicate. So for example, you may have a child and a parent. And this may be difficult because it's a power structure, a power dynamic of, you have a father or a mother and you have a child. But it's really important to set up that structure in terms of how the understanding is in terms of communicating. So for example, the child may say, when I get upset, I like to go to my room. So that parent, the father or the mother, now understands that when that child gets upset, this is what they like to do. There's an understanding there versus there being a conflict whenever something happens and there's an argument and you see them run to their room and there's no explanation why. And then, so now you're creating a understanding of communication. The next one I want to go to is really that preventative work. So this is really looking at how to stop multi-generational trauma and stress. So both of these, the steps I described, are really important steps, but really understanding the multi-generational trauma and stress is, first of all, being able to talk openly with your family about your past history of family and family history in terms of mental illnesses. We're talking about grandma and grandpa's past, and this may be a sensitive subject to talk about for your parents, and it may trigger some type of trauma response as well. But this is really important to bring up as a parent and also as a child, because you want to understand what are some of the behavioral and mental health conditions that may lie in the family lineage, and also what you may be more susceptible to in terms of either maybe your parents have suffered from depression prior, or maybe they suffered from anxiety, and you want to know maybe if you have a more tendency to be that way, what your family history is in terms of what your mother and father and maybe your grandparents have experienced in terms of mental health, if there's been any pre-existing mental health conditions. So this concludes part 1 of the family and mental health video, and please be sure to check in for my next video on part 2 in terms of working with families and the importance of mental health. Once again, my name is Christian Jacobs, Brother Be Well Clinical Advisor. See you later.